We see many patients, and I think the three commonest symptoms that we see, or at least I see, will be number one, chest discomfort. So it can be chest pain, it can be some vague chest discomfort. The second most common will be some shortness of breath, or they feel breathless doing something which was not there before. And I think increasingly common is a lot of patients come to us with palpitations. That means they feel their heart is beating fast, or they feel their heart is skipping a beat, or not beating quite regularly. So all these, I would say these three will be the commonest things that at least someone like me in Singapore will see as a heart specialist. And if you go down the first one, chest discomfort, fortunately for most patients, after our investigations, we find that they don't really have any heart artery blockages. So we label them as either having atypical chest pain, or it could be from a muscle of the chest wall. And that is the commonest one that we see, to be honest. Of course, some of them after tests, we find that they actually have heart disease. And the commonest form of heart disease is blockages of the heart arteries. So this group, when we pick them up, we will then arrange for further treatment as necessary. And for some patients, the chest pain can be due to other reasons. Maybe the heart valve is a problem, or maybe even some mental stress that's causing them to have chest pain. The second commonest symptom will be shortness of breath. And again, many patients, they'll come and see us to say that they feel more breathless over this, let's say, maybe a month or two. And we find that most of them have no actual heart problem. Okay. Again, that is a good news for them. A smaller proportion will indeed have some heart problem. Again, artery blockages is the most common one. Heart valve problem, either the heart valve has become very narrow or become very leaky, can contribute to breathlessness. But some patients actually have something else. Maybe they have asthma that has not been found before, or they have some ear, nose, and throat problem that's causing them to be breathless. And again, in our increasingly stressful society, a lot of these symptoms may be just purely stress-related and nothing to do with the heart at all. We see a lot of patients who come to us with palpitations. Most of them say their heart is either beating fast or skipping beats, and we try to investigate what they are feeling. Most of the time, we find that the patients who complain of heart beating fast actually have a fast heart rate because of stress. Again, when you are stressed or when you are excited, angry, the heart actually responds by increasing the speed, and they actually feel uncomfortable due to that. But it is not a primary heart problem. It is in response to some stress or some mental anger or something like that. And some patients have come to us, and when we do the electrical tracing, we do see that they have a lot of what we call skip beats or missed beats. And in a patient with a normal heart, these are actually mostly benign, meaning they are not dangerous. Okay, the heart has an internal clock which makes the heart beat, but it is never perfect like a watch, for example. So there's always beats that occur early, and once the beat occurs early, the heart will then compensate to delay the next one, and then you will feel like, how come your heart suddenly stopped for 1 second or something like that? Again, these are mostly benign. Of course, some patients, we do find that they have problems. They may have a completely irregular heartbeat due to many years of high blood pressure. As we age, we are also more likely to have irregular heart rhythms, or maybe they have other heart problems like the heart valve problems, heart artery blockage, which makes the heart irregular. For this group of patients, we will try to treat them accordingly and try to make them feel better.